So now we'll look at how CPR changes for pediatrics, for infants and children. So you still want to start and make sure the environment is safe for rescuers and for the victim. If you have a pediatric patient who's in an unsafe spot or you don't have PPE, it's just like an adult. You wouldn't start CPR. You'd call 911 and wait for help. The only difference is it's probably going to be emotionally more difficult for you to not help a child who's, in the middle of a school shooting or a domestic violence dispute or something like that. Same thing if you don't have PPE, wait until you get help. And there are things you can do even if you don't have PPE. You can do hands-only CPR, and that's true for an adult too. If you don't have a mask, a pocket mask to give breaths or a BVM, you can just do chest compressions, and that's going to do a lot of good for the patient. As you do those chest compressions, that's going to circulate the blood around the body, and that blood's going to deliver all the oxygen that's remaining in the blood. It's not like you instantly run out of oxygen the moment you stop breathing. So there's still oxygen. Those chest compressions are going to do a lot of good. So if you don't have PPE or you can't remember what to do, just push hard and fast on the center of the chest, whether it's a pediatric or an adult. That'll do a lot of good. But you want to make sure the scene is safe, and preferably you have the appropriate PPE to help somebody so you can do full-blown CPR. So cardiac arrest in a pediatric, very similar to an adult. You're still going to check for responsiveness. You're still going to check for a painful response. You're still going to check for breathing, and you're still going to check for a pulse. So in the big difference is in children and infants. So anybody who's pre-puberty, anybody who hasn't hit puberty yet, if they have a pulse less than 60, you're still going to start CPR. For an adult, if they have a pulse less than 60, they're still alive. We're going to leave them be. But for a child, if their pulse is below 60, we know their pulses normally run higher. So if it gets below 60, it's on the way to stopping. And that's because when children go into shock, their body fights really hard, and their heart will continue to beat until the heart tissue runs out of oxygen, and the heart tissue itself gets hypoxic. And the heart has to work hard to keep beating, and it starts to beat slower and slower and slower, just to try to keep pumping blood. It's kind of like if you're at the gym doing bicep curls and you had to do bicep curls to stay alive. You wouldn't just go as fast as you can and then all of a sudden drop the weight. Before you drop the weight, you would do some slow bicep curls, just trying to stay alive. And that's what a child's heart does. It beats, it gets slower and slower before it stops. So once the pulse is below 60, it's on its way to stopping. We'll start CPR even if they have a pulse, as long as it's below 60. Just like an adult, we'll check that breathing and pulse at the same time. In a child, as long as they're over age 1, we'll check the pulse in the same place. We'll still check that carotid pulse right in the neck. As long as they're over age 1, we'll get to infants separately. EMS, calling 911. If you're on the ambulance, ignore all this, you are 911. But if you're not on the ambulance and you just find a child who is in cardiac arrest, you have 2 different things you can do. If you saw the child go down, you do the same thing as you would for an adult. Leave, go get a phone, call 911, get an AED, come back and start CPR. If it's unwitnessed, you just go into a room and you find a child who's down, you have no idea what happened. You're going to do 2 minutes of CPR before you leave them to call EMS and get an AED. That's because a lot of times a child who goes unresponsive, it's usually caused from choking, and the 2 minutes of CPR may relieve the choking and save their life without even having to call 911. So we're going to do those 2 minutes of CPR before we go get help if we didn't see what happened. If we witnessed it, then we were already treating them for choking. We're going to run and go get a phone and AED, and then we'll come back and start CPR. Okay, age 1 to puberty, we're going to do, if you're by yourself, you're going to do the same thing as you would for an adult. 30 compressions to 2 breaths. The 30 compressions are still at the same speed. They're still 100 to 120 a minute. So 30 compressions, 2 breaths. The difference is, instead of going at least 2 inches deep, now you're going to go about 2 inches deep with each compression. Another way to look at it is 1/3 the thickness of the chest. Now here's where it changes. If you have 2 or more rescuers and you have a child, you're going to actually do 15 compressions to 2 breaths. If you have 2 or more rescuers, it's really quick to just pause those compressions, 2 breaths, right back to compressions. If you're by yourself, it takes too much time to leave the compressions and go to the breaths. But children have a much higher oxygen demand, so 15 to 2 if you have 2 or more rescuers, and you can quickly go between breathing and compressions. when you do your compressions on a child, instead of using both hands, you can use one hand on the middle of the chest. It really just depends on the size of the child and on the size of you. So if you're going too deep with two hands, you can try to do the compressions with one hand. When you come in to practice CPR to do the skills, I have a child mannequin, so you can practice with two hands and one hand and see which one feels better for you. Okay, infants. So 1 month up to 1 year. So now we're talking about somebody who's less than 1 year old. We still start with scene safety. We're still going to start by checking for responsiveness and checking for a pulse. But instead of checking a carotid pulse, we're going to check a brachial pulse, which is in the upper arm, just along the humerus. And you're going to push their little baby muscle out of the way, put your hand along their humerus, and with 2 or 3 fingers, you can feel along the entire humerus, and you'll feel for a brachial pulse. You can also check a femoral pulse down in the crease of where their diaper is, the crease of the leg, basically where their diaper lies. Just like a child, if they have a pulse less than 60, you're still going to start CPR. Just like a child, if you're by yourself, you're going to do 30 compressions, 2 breaths. Just like a child, if there are 2 or more rescuers, you're going to do 15 compressions, 2 breaths, because again, it's really quick to switch from those compressions to breaths. Now, to do the compressions, we're not going to use our whole hand. If you're by yourself, you'll just use 2 fingers right in the middle of the nipple line, just like you would for an adult, but you're going to use 2 fingers instead of your whole hand. And if you have 2 or more rescuers, you'll do 2 thumbs encircling, and you'll basically hold the child and use your thumbs to do the compressions. And you'll see that in the video we're going to watch here in a second. And then notice, instead of about 2 inches, for an infant, we're going to go about 1.5 inches for each compression. Okay, let's see how that's done here, and then we'll wrap up the pediatric CPR.
For 1 person infant CPR, you would do 30 chest compressions followed by 2 breaths, the same as you would for an adult. You will use 2 fingers in the center of the nipple line, just like for an adult, but 2 fingers, same rate. Ten. 26, 27, 28, 29, 30. Head tilt chin lift, followed by 2 breaths, right back to the chest compressions. 1. And you would do 30 and then back to 2 breaths. For 2 rescuer infant CPR, I can now have 1 person here, 1 person on the other side. At this point, you can do what's called 2 thumbs encircling. So you would be holding like this. Of course, you'll have the baby laying on the table. So since I'm doing 2 rescuers, I would have another rescuer giving breaths. I will only do 15 compressions before I give 2 breaths. So.
Do you want these back?
10. 15. Just like that.